Hey CHWs, and welcome back to Public Health 101. Today we're going to be talking about the science of epidemiology. It might be something that some of you have heard about in the last few years with the rise of COVID, but it's a very deep and analytical science that has a huge effect on public health. So we at least want to give you some kind of an introduction into this science so that you understand all the work that is going on behind the scenes that are affecting your work as a community health worker. So today we're going to try to define epidemiology, give you just a working definition to understand what people mean whenever they bring it up. Talk about some of the concepts and the terminology, the difference between them, even though they may seem similar. We're going to try to make as many distinctions as we can and identify some of the methods of data collection and how we interpret that. So first off, what is epidemiology? Well, the definition is the study of the distribution and determinants of health-related states among specified populations and the application of that study to the control of health problems. But more plainly put, we're talking about, it's a really basic science, and it literally means the study of what is upon the people. So what the science is doing is looking at the distribution, how things are moving around, what are the determinants, what are the things affecting those, and within a specific population. And when we say that, we define what that specific population is. Who are the people that has something upon them? So the purposes of epidemiology are fourfold. They're to discover, determine, identify, and evaluate. So when we talk about discovering the agent, host, and environmental factors that affect health, and if you take COVID-19 for example, the agent in that case would be COVID-19, the virus itself, and the host would be the person. If you got COVID-19 or someone you know, that person would be the host, and of course the environmental factors around that. When we're trying to determine, the causes of illness, disability, the death, we're thinking about who and how a disease is developing. And of course, we're identifying specific populations, and sometimes we can highlight through epidemiology groups of people that are more prone to a specific illness. And finally, we want to see how implementations of interventions can affect a specific health problem to try and improve health overall. So of course, health overall, it's got a public health outlook and a focus. So how do we approach these problems? Well, when we're trying to solve a health problem, we go through some 4 steps, and we're gonna we want to show you this model, but we'll be going a little more into depth about how we try to solve these. Think of a public health issue that you might have experience with. Think, how does a person develop disease, and why does this happen? You could take a lot of approaches towards that. And is an action more effective among some populations over others? We're going to use this 4-step process in epidemiology to try to answer those questions. So step 1, data collection. Surveillance. When and where did the health problem occur? Step 2, assessment. What can we derive or try to understand based on that data we just collected? Again, maybe a specific group or population is more affected by a specific health problem. Once we infer that, we start creating a hypothesis, and testing those to try to determine how and why. What are the important factors that led to the development of the problem? And finally, what actions can we take to try to intervene and solve this health problem? What activities should be taken so the health problem is lessened? And a lot of the times as community health workers, this is where where we come into play. We go in and we make the action. We're the ones that are intervening and trying to create prevention with these specific health problems. So we're going to take a quick break and answer a couple of knowledge checks real quick.